Hi viewers, I hope you are fine. So my topic is about autosclerosis. So what is autosclerosis? The autosclerosis is basically a localized disease of the ear in which there is a replacement of the normal bone of the aortic capsule or the bony labyrinth with the spongy bone. The spongy bone is basically an immature bone and it has greater thickness and cellularity and vascularity as well. So now I'm going to discuss the epidemiology regarding the autosclerosis. So basically it occurs 10% in Caucasians and 5% in Asians and 1% in African American and 0% about almost absent in the case of Native Americans. So if we talk about the race, so mainly the fair complexion, those with fair complexions are basically involved in that disease. So now here is the etiology regarding the autosclerosis. So the most common cause is the genetic cause or the hereditary cause, which is about in 50% of the cases. Moreover, a person with autoimmune antibody against the type 2 collagen also responsible for that disease. Moreover, the infectious diseases, mainly the viral infection, persistent viral infection which occurs on the affected bone may be result into the formation of the autosclerosis. Moreover, there is also a biochemical cause in which there is a secondary remodeling occurs in the cartilaginous area of the aortic capsule, which may result into the autosclerosis. Mostly it is basically caused in women as compared to the men, and basically it occurs in 20 to 30 years of age, and basically the symptoms of the autosclerosis can be worsened because of the pregnancy and trauma as well. So moreover, if someone is taking the contraceptive pills as well as someone is taking there is a replacement of the female sex hormone is also responsible for worsening the condition of the autosclerosis. So if we talk about the pathogenesis regarding the autosclerosis, as we have discussed earlier, there is a replacement of the normal bone of the aortic capsule or the bony labyrinth with the spongy bone. So this process basically occurs in the endochondral layer of the aortic capsule or the bony labyrinth, and the autosclerosis only occurs in the bony labyrinth and no any other bone of the body. So when the autosclerosis occurs, it can cause it may mainly occurs anterior to the oval window, and sometimes it occurs in the other parts of the bony labyrinth, but it doesn't produce any clinical manifestation like the autosclerosis which occurs anterior to the oval window. It may when it occurs in the anterior to oval window, it may result into the fixation of the stapes, and it can actually reach to the margins of the oval window. It can even extend to the cochlea as well. So it not only causes the conductive type of deafness, which is a paraacusis willisii, but also responsible for the sensory neural type of deafness if the cochlea is involved. So if we talk about the conductive type of deafness, we can check it by the Weber's test, which is basically lateralized to the affected side, and we can also check it by the Rinne's test, which is also negative in that case. If we talk about the flamingo pink tingy or the Searchworth sign, so it is also the characteristic feature of the autosclerosis, in which the tympanic membrane is normal. However, if you see through the tympanic membrane, you can easily see the hyperemia of the promontory. It occurs in 10% of the cases of the patient with autosclerosis, and if we talk about the Austrasian tube, so on Valsalva maneuver you can see that the Austrasian tube is found to be patent. So next is the pure tune audiometry. So we are now going to investigate the autosclerosis. So we have to investigate by the pure tune audiometry. So the two characteristic feature of the autosclerosis of the pure tune audiometry regarding the autosclerosis that the airborne gap is large. So if we talk about if there is an airborne gap is present, because the bone conduction is better than the air conduction, because in the conductive type of deafness, so the value of the bone conduction remains same, however the value of the air conduction become less. That's why there is a gap is formed between the air and bone conduction, so it form a airborne gap. Moreover, it also shows a notch. So there is basically a this notch is known as the Carhar's notch. This notch is formed when there is a dip of the bone conduction at the frequency at the 2000 Hz of frequency. So it is basically characteristic feature. The Carhar's notch is a basically characteristic feature of the autosclerosis. So if we talk about